Platform number 2, promoting health and preventing ill health. Registered nurses play a key role in improving and maintaining the mental, physical, and behavioral health and well being of the people. So, as a registered nurse, we play an important role. Here it is written, it a vital role. We are responsible as a nurse for our patients' mental and physical health and well being. Also, we are responsible for the families, communities, and population. So, wherever we are working, whichever part we are of, we are responsible as a nurse. They support and enable people at all stages of life and in all care settings to make informed choices about how to manage health challenges in order to maximize the quality of life and improve health outcomes. So here they are saying that we are supporting, also we should be supporting too, and they should be able to make right choices. We should enable, means we should help them in the best possible way by role modeling or by promoting or by communicating or advising in whichever area we should be able to promote good health among them so that they make good choices about their health and many disorders and disease which can be prevented to this. Next is they are actively involved in prevention of and protection against diseases and ill health. So as a nurse, we are actively involved. We come across patients, we come across people around us. So we are actively involved in the decision making by influencing them, by advising, as I told you, so that they can prevent before anything happens to them. They can take measures and also protection against disease, and they can protect themselves in public health, community development, and global health agencies, and in the reduction of health inequalities. As we can see in the world, there are many inequalities in health due to lack of health knowledge or due to various reasons. So as a nurse, we are actively participating in it. We directly can communicate with people. We can be a role model. So here the platform 2 suggests all these things. Platform 2 outcome. The proficiencies identified below will equip the newly registered nurse with the underpinning knowledge and skills required for their role in health promotion and protection and prevention of ill health. So as you can see, the second platform which talks about promotion of health and prevention, of ill health. So how to do this? What are the outcomes of it? As a nurse, what we are supposed to do? At the point of registration, and the registered nurse will be able to do, number 1, understand and apply the aims and principles of health promotion, protection, and improvement and prevention of ill health when engaging with people. So when we are engaging with people around us, so our clear objective, the principles, like what we are supposed to do, it should directly relate to the promotion of health. Like we promote the health, proper health. If any disease they have, so we should be able to first of all prevent it if it is not there. If it is there, we should be able to protect their ill health. Number 2, demonstrate knowledge of epidemiology, demography, genomics, and the wider determinants of health, illness, and well being, and apply this to an understanding of global patterns of health and well-being outcomes. So here it means that the nurse should have the basic knowledge of the medications or measures which we take to prevent ill health or for which we need for prevention. That is called epidemiology. And demography is like the population which we are concerned about. Yeah, we should know that what are the different varieties or categories or different things happening in the population. And genomics is how the things affect the different genes, genetics, due to genetics and all. And there are different factors. Determinants are nothing but there are different factors affecting our health, illness and well-being. And accordingly try to apply this to the global patterns. Yeah. So taking in consideration different geographical areas, different culture people, what are their genetics, yeah, and how the preventive measures work for different people. Accordingly, she should be able to act. Understand the factors that may lead to inequalities in health outcomes. The nurse should also be aware about all the factors which can discriminate or in any other way it can prevent discrimination and the inequalities happening in the society or in the health outcomes. So she can act accordingly. Fourth, identify and use all appropriate opportunities, making reasonable adjustments when required to discuss the impact of smoking, substance, alcohol use, sexual behavior, diet, exercise on mental, physical, and behavioral health and well-being in context of people's individual circumstances. So the nurse should be able to guide people in every aspect of their life. As you can see over here, if they are using any abusive substances or their mental health is deteriorated or they need any physical care or behavioral health, so she should be able to guide them, give them proper choices to make, advise them and take care. Fifth one, promote and improve mental, physical, behavioral and other health related outcomes by understanding and explaining the principles, practice and evidence base for health screening programs. So as a nurse, we should guide our patients for screening programs. Screening programs are the programs which are initiated by institutions or healthcares to tell patients about the importance of checkups and also help them to make any preventive means they can take up any preventive care if they come across any health issue, or if they come across that their family is having a particular history, or they are having any symptoms regarding any first stage of any particular disease. So this nurse should guide them for evidence based or practice, or make them understand and explain the principles they should be following for their proper health. Sixth one, understand the importance of early years and childhood experiences and the possible impact of life choices, mental, physical and behavioral health and well-being. So as they should be working, as a nurse we should be working in different care settings, but here it is told that she should know that what the early age matters, yeah, of childhood. and accordingly the main habits or the healthy habits we can start from the early time. So she should guide parents, also children. Then seventh one, understand and explain the contribution of social influences, health literacy, individual circumstances, behavior and lifestyle choices to mental, physical, so physical, behavioral and health outcomes. So here they are saying that our choices matter. Whichever choice we make, that matters in the long run. So the lifestyle choice which we make, how we should be staying, or the social influences, health literacy, the health education what we have. Yeah. So everything matters, and we should be able to understand this as a nurse. And also we should make sure that our patient knows that how the external factor can influence them and what all they should be taking care of. Eighth one, explain and demonstrate the use of up to date approaches to behavior change to enable people to use their strengths and expertise and make informed choices when managing their own health and making lifestyle adjustment. So again and again they are saying that we should be helpful to society, community, wherever we are staying, and to the public and patient, that they make proper choices, and with the informed knowledge they should be making their they should be taking the right decision, and their strengths and expertise should help them to have a good lifestyle so that their health improves. Ninth, use appropriate communication skills and strength based approaches to support and enable people to make informed choices about their care, to manage health challenges in order to have satisfying and fulfilling lives within the limitations caused by reduced capability. Yeah, so reduced capability, ill health and disability. So here they are telling that we should work on our communication skills, like we should make them understand that what are their strengths, even if they are vulnerable mentally or physically. We should make sure that they look up at their strength, and through their strength they get motivated to perform activities which are important for their health, or to make right choices for their health. Yeah, so we should influence in this manner. There are some people who now underwent or suffering from some health issue, but still, even though there are some limitations, we should make sure that they know how to cope up with it and how to sustain their life, like rehabilitative care. Next is 10th, provide information in accessible ways to help people understand and make decisions about their health, life choices, and illness and care. So the information what we give them, what we provide them, it should be accessible to them. For example, if we are asking them to follow a particular diet, so we should make sure that they have that diet with them, or the diet chart with them, or we can guide them to a particular channel, or we can guide them to a particular website so that they can access it and work accordingly for their health. Promote health and prevent ill health by understanding and explaining to people the principles of pathogenesis, that is, what are the reasons, like genetics also are the few reasons. So patient should know that their history can be the reason for particular things, so how they can prevent few things to happen to their health. Immunology, the immunity and all, and the evidence based for immunization, vaccination, and herd immunity. So they should have the knowledge of vaccination, immunization. Yeah. Next is protect health through understanding and applying the principles of infection, prevention, and control, including communicable disease, surveillance, and antimicrobial stewardship and resistance. They should know what are the preventive measures, what vaccination they should be taking, if any communicable disease are there, what measures they are supposed to take. Yeah. And what are the antimicrobial stewardship and resistance, how it works, how the medicine works, how the preventive measure works. They should be knowing all of this so they can prevent any ill health. The next content of this video is in the next video. You can see the link in the description box. The content in the video belongs to NMC. We are just trying to explain it so that you can do the self study. We are taking effort to make all these things for y'all. So please y'all also make an effort to like and press the bell icon and comment if you really liked it.